Life-threatening transfusion reactions usually occur within 15 minutes of initiating a transfusion.
Anna, this is Mrs. Smith.
Hi. Nice meeting you.
Remain with a patient during this time to monitor her physiologic responses. After 15 minutes, if the patient is stable, checking vital signs can be delegated to nursing assistive personnel.
If you start feeling different in any way, if you feel hot, if you feel itchy, just let me know immediately.
Okay.
Thanks, Anna.
Okay, you're welcome. Mrs. Smith, I'm going to do your vitals, okay? Let me do your temperature first.
Shaking, chills, fever, shortness of breath, and headache are examples of signs and symptoms of a transfusion reaction.
I feel dizzy.
You're not feeling well?
No.
If these or any other signs of a transfusion reaction occur, stop the transfusion immediately and notify the healthcare provider. Do not leave the patient alone if you suspect a transfusion reaction is occurring. If the healthcare provider determines that the patient's symptoms suggest only a mild allergic reaction, you may be directed to administer an antihistamine and restart or discontinue the transfusion. A more serious reaction requires prompt and decisive intervention. Remove the blood component and tubing containing the blood product. Replace them with a bag of normal saline and new tubing. Make sure the site into which the normal saline will be infusing is patent, and connect the tubing to the hub of the intravenous catheter. Do not leave the patient. Continue to monitor the patient's vital signs and make sure the blood bank is notified of the patient's transfusion reaction. Return the remainder of the blood component and attached tubing to the blood bank per agency policy. If you need to obtain blood samples, use the extremity that was not used for the transfusion. Follow your agency's policy regarding the number and type of tubes to be used. Continue to monitor the patient's vital signs every 15 minutes, or more often if needed. You will also need to obtain a sample of the patient's first voided urine and send it to the laboratory. Administer any prescribed medications according to the type and severity of the patient's transfusion reaction. Be prepared to initiate cardiopulmonary resuscitation in the event of cardiac arrest.